this thing's working. I'm not sure. Hold on, let me check. Oh, yep, it is. Okay, so I'm going to talk about more specifically the appointments I've been to that I can remember. It's been so crazy. Mainly just the radiation right now. I haven't been to my chemo appointment, so I don't know too much about that yet. So we'll find out. So where the place where you're going to be radiated on, where the radiation is, they want you to take care of it with different skin care guidelines. So I'm going to read you off this paper that they gave me. Moisturizing. Step 1. Apply a healing gel, aloe vera or calendula, and allow area to dry. Step 2. Next, apply moisture. See examples on the next page. Start moisturizing on the first day of radiation 3 times a day, 7 days a week. Do not apply any lotion 2 hours before treatment time. You may apply moisturizer immediately after treatment. Continue moisturizing 2 to 4 weeks after radiation therapy has completed. Bathing and showering. Use lukewarm water with mild soap that will not dry your skin. See examples on the next page. Lather the soap gently around your hand. Rinse and pat dry. Do not use a washcloth. Do not wash off the marks that therapists place on your skin. Do not remove any tape that the therapist placed on your skin. Do not shave any skin in the treatment area. Do not use any antiperspirant on treated skin. I can wear it because I'm not being treated up here. I'm being treated down there because I have rectal cancer. Kind of embarrassing. Why me? Anyways, God has a plan. I see his fingerprints, but it's hard sometimes to know it's happening to me, but I don't know. Clothing. Wear clothing that's not too tight or irritating to the skin. For breast radiation patients, which is not me, do not wear a tight bra or underwire. Protect the treated skin from direct sunlight. Other guidelines. Do not expose the treatment area to extreme temperatures. Hot tubs, saunas, ice packs, or heating pads. Before swimming in in the pool or in the ocean, please ask the nurse or physician for advice. If you have any questions or concerns, please call us. I don't see a next page, so I don't know. But I had a pelvic radiation planning visit. That's what it says on this paper. Your next 2 appointments are, and then they have a schedule. Simulation. The purpose of this visit is to determine the ideal position for the radiation treatment and to map out your anatomy in the position with the use of the CT scanner. This visit will take approximately 1 hour. I have had this visit. It wasn't pleasant, but I survived. Before you arrive, you must bladder filling. When you arrive at this simulation, empty your bladder and drink 2 glasses of water. This should be approximately 45 minutes before CT scan. I did not do that. Shh, don't tell anyone. I just drink whenever I wanted to. The timing and amount of fluid intake prior to your daily treatment should mimic that before your CT scan. I am going to ask questions about that because I'm confused. Oral contrast may be used in certain cases. Drink oral contrast 1 hour before CT scan. If required, you should have picked up your oral contrast from Kaiser Permanente Pharmacy. Yes, I belong to Kaiser. Probably shouldn't have said that either. But there's lots of Kaisers everywhere. So after you after your consult. Pain medication. If you're unable to lie still on a hard table, yes, it was a hard table, I will read my diary about everything. After, I don't know, I'll do another video of that, of this visit. I wrote a lot of things down that I wasn't comfortable with, but I got over it. It's just my way of coping. I journal. You should take some pain medication prior to appointment. I probably already read that, but that's okay. During simulation, an IV may be required for administration of contrast before definition of location of the target on CT scan. I didn't have an IV, or I didn't need to take any contrast. I don't know, I guess I got off easier than I thought I did. But this is so degrading. A narrow rubbery tube will be inserted into your anus with air introduced into the rectum to help better define the rectum. I did not like that. It didn't hurt. It's just, I don't know. I'm not okay with it, but they know what they're doing, and that was embarrassing. I'm like, okay, what are you doing? And I forgot to read this paper before the appointment. I read it now, and now I know to read papers before appointments. I'm learning. Okay, this is pre-treatment check and first treatment. So I had the first treatment December 5th at 1:30 p.m. So you can pray for me. It says, please arrive 15 minutes prior to register and change into gown. During this appointment, we will verify your treatment fields by taking x-rays. These x-ray images help ensure that you are properly positioned for your treatment. Your medical team will review and confirm all of the information collected at your previous visits. Your treatment team will verify that the fields created during planning correlate with those taken on treatment machine. Adjustments may be made to achieve this goal. Once the correlation is confirmed, additional permanent reference marks may be made on my skin. I might need more tattoos. I have 3 now. 3 little teeny. They were pricks. They felt like little pricks. Oof. I'll read that to you in my journal. We may contact you to change the date and time of this appointment. This may be necessary in order to provide the best possible care for you. If your appointment needs to be changed, we'll explain why and do our best to work with your schedule. I might need to change it because my husband wants to go with me, and he's going to have a hard time getting home from work by 1:30. So anyways, preparing for pelvic radiation. Hopefully I don't go over time. I don't know how long this is. Let me check. Oh wow, I am going to read this in my next video. Okay, bye.